Knowledge increased by sharing and not by saving. Knowledge is power. Knowledge shared is power multiplied. And investment is in knowledge always pays the best interest. Let's start our first step today. Dear Excellencies, distinguished delegates, scholars, and scientists, it's my pleasure to be a session chair of the day. My name is Rakesh, and on behalf of Texila A Conference, I would like to extend a warm welcome to the 8th International Scientific A Conference. Texila A Conference is conducting conference for 9 years in a row. Texila has made revolution in a way scholars attend academic conferences and has attracted more than 8,500 participants and from 80 plus different countries. Texila A Conference stands in the front row conducting virtual conferences, saving your valuable time, money, and guarantees the comfort you require. The topic for this year is embracing environmental change and transformation breakthrough, innovation and creativity, leading change, re-engagement. The primary reasons why we selected this topic is change is difficult to accept for everyone, but change is constant in life. In the universe that is subject to state of constant entropy, change is inevitable. No matter how hard it is, we will have to work through the changes in our life and make the best out of them. In the past, COVID-19 brought the world to a standstill and changed everyone's life, but humanity has found a way and is working towards a better tomorrow. Embracing the change that sound as the first step towards innovation. Without change and innovation, humanity would not be what it is today. The COVID-19 pandemic forced us to innovate. The crisis that changed everything altogether gave rise to opportunities to innovate and benefit from it. Those who reacted to the problems with creativity, react and the benefits of their innovation. The world saw massive innovation in medicine, technology, public health, logistics, etc. Development has been many folds in the past 2 years. Embracing the change and innovation are what transformed how the world runs. Learn how embracing a change can help with creativity, innovation, constantly transformation. And before I conclude, dear all, I want to share few operating instructions for the participants. All participants should check your speaker settings to make sure the presentation is audible. Those who are making presentation, please enable your mic from the toolbar at the top and share your webcam by clicking on the start webcam from the sidebar. At the end of each presentation, there will be a Q&A session for 10 minutes wherein you can post your questions and it will be answered. So we will start our first presenter. I now request Ms. Adaora Isabella Odis to present on the topic Epidemics and Vaccination Dilemma in Complex Networks, a case study of Kosfi and Shumol local government area, Lagos, Nigeria. Ms. Adaora Isabel.
Good morning, everyone.
Good morning, Ms. Adaora. How are you?
I'm fine, thank you. How are you?
Okay, the stage is yours. You can share your presentation and start.
Good morning, everyone. Epidemics and Vaccination Dilemma in Complex Network, a case study of Kosofe and Shumolu local government area, Lagos, presented by Dr. Adaora Isabella Odis. Introduction. Vaccine saves millions of lives and protect you and your family from serious infectious diseases that can cause disability and even deaths. Vaccinate Your Family 2019. One of the most important challenges in implementing an effective immunization program is to ensure that enough individuals agree to get vaccinated. This decision could be based on many factors, such as individuals' knowledge about costs, including perceived side effects and benefits of vaccination, as well as the social, economic, and cultural environment to which they belong. With the latest advances in science and technology today, safe and effective vaccines exist for many of the most common infectious diseases, such as smallpox, measles, polio, influenza, hepatitis, chickenpox, diphtheria, and the use of vaccines has been estimated to save millions of children's life per year. However, due to economic costs of vaccination and often also personal beliefs and the fear of vaccination after effects, people usually regard vaccination as voluntary rather than compulsive measure. In this sense, behavioral vaccination, borrowing the framework of behavioral dynamics in the game theory and psychology, becomes a useful research framework to elucidate real-world diseases spreading prevention. Now we'll go to literature review. More than 1,400 microbes are known to cause disease in man, and these are therefore classified as pathogenic microbes. A majority of the microbes on Earth are being to man, and some may actually be beneficial to the ecosystem. Of the 1,400 pathogens, only about 12% are responsible for emerging and re-emerging diseases. At least we are familiar with over 80% of the pathogenic microbes, even though we may not always have potent weapons to destroy each and every one of them. Nevertheless, in the most instances, we have been able to maintain some reasonable equilibrium such that they do not constitute a threat to human survival, except when these microbes mutate. Oshibog, 2014. Boosting pneumonia services will prevent 1.2 million extra child deaths from one major childhood disease at the same time. UNICEF 2020. My research questions. What is the level of knowledge of parents about epidemics and vaccination in complex networks? What are the factors affecting vaccination uptake in complex network? Complex network now means the location, Kosofe and Shomolu local government area. Does the cost of vaccine like rotavirus and pneumococcal affect parents living in Kosofe and Shomolu local government area that wish to vaccinate their children? What is the proportion of parents living in Kosofe and Shomolu local government area that are currently using vaccination? Now, the objectives. The objective is just almost like the finding the research questions. Now, to establish sociocultural factors as defined by education, religion, cultures that affect infection in Kosofe and Shomolu local government area of Lagos, Nigeria. To outline sociocultural factors as defined by education, religion, and cultures that affect vaccine effectiveness and uptake in Kosofe and Shomolu local government area of Lagos, Nigeria. The third one is to examine economic factors that affect vaccine uptake among residents of Kosofe and Shomolu local government area. The fourth one, to determine the probability of infection, vaccine effectiveness, cost that give rise to nonlinear responses in vaccine uptake. Null hypothesis. High costs give rise to nonlinear responses in vaccine uptake, and there may be other significant determinants like level of education, religion, media, choice, and decision of head of family, which determine epidemics and vaccination dilemma. Now, we all know that public health is a science and art of preventing diseases, prolonging life, and improving equality through organized efforts and informed choices of society, organization, communities, and individuals, analyzing the determinants of health of a population in terms of epidemics and vaccination dilemma, which is the basis of public health. Methodology. Study population comprised of all parents, child caregivers in Kosofe and Shomolu local government area. The study subjects were mothers, fathers, and child caregivers that use Kosofe local government health center, General Hospital, Wagada, Arjolat Hospital to vaccinate their children. This comprised of those that take vaccines as well as track epidemics, both emerging and re-emerging diseases. Study design was a cross-descriptive It was a descriptive cross-sectional study and was carried out to assess the epidemics and vaccination dilemma among parents or caregivers at Kosofe and Shomon local governments. Inclusion criteria was for mothers and fathers and child caregivers or guardians that use Kosofe and Kosofe Health Center, General Hospital, Arjulad only. Exclusion criteria, those that do not use, because there are other hospitals in Wagada, but we didn't use those ones. The sample size, we use the program formula, and I got 368, but to give allowance for non-response, I used 5%, added extra respondents, making it 387. But when it went to the field, about 375 completed their questionnaire. This is the formula for the sample size. Now, sampling technique. I use a multi-stage sampling technique to obtain data from Lagos State. We have about 37 local government areas in Lagos, and we had to classify them. Stage 1, balloting method of simple sampling, random sampling was used to pick 2 local governments out of the 37 local government. That's for stage 1. That's stage 2. I then classified the health facilities, government hospitals, private hospitals, and health centers, and picked 1 from each. That's why we arrived getting one government hospital, which is General Hospital, then 1 health center, which is Kosofe Health Center, and the third one, 1 private hospital, which is Arjulad Hospital. 2 is used for data collection. It was an interview-based questionnaire and informed respondent form that we used. Ethical consideration. Approval was got from Lagos State's HREC, and then permission was obtained from the Lagos Health Service Commission, and also from the principal and director of nursing at Arjulad, which is a private hospital. It's not under the government. Participation was voluntary, and all participants were required to provide written informed consent, and they were assured of their confidentiality regarding information collected from them. Results. Our model age was 30 years, the youngest was about 17 years, and the oldest was about 59 years. Knowledge. Parents, guidance that strongly believe politicians should be role models that encourage vaccination were 61.87%, while 4.53% strongly disagree. More than half, 50.67% of mothers were not sure if there is still a link between MMR, that's measles, mumps, and rubella vaccination, and autism, while 21.07% and 18.13% strongly agree respectively that there is a link between MMR, that's measles, mumps, and rubella vaccination, and autism. 6.13% and 4% strongly disagree respectively that there could be link between MMR vaccination and autism. The difference between parents and guardians that worry or do not worry about vaccination are irreversible is 1.60. This is a vaccination dilemma, and about 21.0% were still not sure if they were worried that vaccination were irreversible. This simply means that we need to continue creating awareness campaign on vaccination or immunization. More than half of parents' guidance, 27.73% and 24.53%, strongly agree respectively that they worry about possible side effects of vaccination. Only 11% were not sure if they worry or not. This is a negative vaccination dilemma and needs intervention. Majority of parents strongly agree that media reports of vaccination encourage them to vaccinate their children. This means that media plays a key role in vaccination campaigns, awareness, and intervention, and should be promoted more to achieve the goal of ensuring all children are vaccinated properly. Majority of parents, 70.93%, believe vaccination programs are worthwhile. This is a positive vaccination dilemma. About 32.080% strongly agree, and 22.40% agree that media exaggerates reports about disease outbreak. Some mothers further explain that Nigerian government is using the media to exaggerate reports about COVID-19 so as to get funding from international community. Some mothers at Kosofe Health Center and General Hospital do not believe that there could be COVID-19, and we're not taking proper safety measures as seen at Adaora Hospital, where mothers were seen being so cautious. They wore nose masks, maintained social distancing, were seen with sanitizers, which they were using often for themselves and children. This is where the level of education plays an important role in the level of knowledge and attitude towards epidemics and vaccination. Because those that come to that private hospital, Adaora, most of them are educated. Parents, 64.80%, strongly feel that they were well informed about vaccination for their children, while only 1.33% strongly felt they were not well informed about vaccination for their children. Majority, that's 94.40%, were responsible for making decisions for their children's immunization, like remembering the next appointment, bring the child or children to hospital for immunization, keep the immunization card properly, making payments for immunization, while only 5.60% were not solely responsible for making decisions for their children's immunization because they needed the head of the family, which is the husband, to make payments, give consent, and also drive the mother and child to the hospital for immunization. The highest level of education of respondent vessels, I believe it is a question. I believe it is important for my child to receive all the necessary vaccination. The chi-square test result was 0.00. This means that there was a significant positive association between the level of education and knowledge of parents on epidemics and vaccination. The level of education of parents had influence on their knowledge of epidemics and vaccination uptake. Highest level of education of respondent versus, I still believe there could be a link between MMR, that's measles, mumps, and rubella vaccination and autism. The chi-square test was 0.464. This means that there is no significant association between level of education and knowledge of parents on epidemics and vaccination. Level of education of parents had no influence if they still believe there could be a link between the MMR vaccination and autism. Now for results, my section C. We could see healthy practices. You could see that all the scores here, most of them were 90-something, 80-something. The least was getting outside each day. This research was carried between January and February of 2021. In Nigeria, young children just started school in September. Most of them started in January. So people were still afraid of COVID-19. So they said that they were not getting out, allowing their children to get outside every day. And then we could see brushing of teeth. Some complain that when they come back from work daily, they come back late. Sometimes they meet their children sleeping, so they do not have time to brush their children's teeth. And then another one we had an issue was having regular dentists and doctors checkup. This is not something that is well practiced in Nigeria because of the population we have. I've even had experience when a pediatrician asked me I should only come to hospital when my child is sick. So I guess that's why we're having this kind of percentage for extremely important when people consider it important. Attitude. 45.87% of parents' guidance were totally concerned that their children or child could still contract a disease for which he or she has been vaccinated for. Some parents further explained of some children that have taken measles and chickenpox vaccination and still had measles afterwards. I had the experience. My child had chickenpox in February last year after she had taken the complete dose of chickenpox vaccine. 20.27% of parents were not concerned that their children could still contract a disease for which he or she has been vaccinated for. 35.20% of parents thought it was not likely at all that one or more childhood vaccine may cause long-term or negative side effects to their children, while 18.93% of parents thought it was totally likely, and 23.73% were not sure. This is a positive vaccination dilemma. 43.7% of parents and guardians were totally concerned that their own child may contract a vaccine-preventable disease and suffer a serious reaction to the disease, while 21.33% were not at all concerned, and 14.40% were not sure if they were concerned or not. 43.47% of parents' guardians were totally concerned that their own child may experience a bad reaction or childhood vaccine, while 20.53% were not at all concerned, and 13.33% were not sure. This is a negative vaccination dilemma. Majority, 87.20% of parents, guardians, indicated that it would be extremely helpful to have more information about the benefits and possible health risks of childhood vaccines with statistics and data that are complete, easy to understand, and not biased to sway their decision in a certain way. 78.93% of parents, guardians, indicated that it would be extremely helpful to have more information about the prevalence of vaccine-preventable childhood diseases in their local governments in Lagos State. Now, the modal age for the oldest, those that have oldest child, the modal age was between 1.6 years old, and the mean was 2.21, while the standard deviation was 0.94. Parents said yes, that their oldest child had received 5-in-1. That's the 5-in-1 is this diphtheria, tetanus, polio, Hib, which is recommended at 2 months, 4 months, 6 months, and 19 months. You could see it's 93%. And they've also taken MMR vaccine, which is 92%. We're taking hepatitis B, which is 99.73%, and pneumococcal, which is 97.33%. While parents said no, that their oldest child had not received the chickenpox vaccine. You could see the figure there, 64.80%. Influenza, 78.93%. This influenza vaccine just came in, I think it came in about 2018 or 19, because for my first 2 children, I didn't give them influenza vaccine. But for my 3rd child, she took the influenza vaccine, and I could see the effect of the vaccine. She wasn't always having flu. Then HPV vaccine, you could see 95.47%. Cholera, 65.33%. All these vaccines are expensive and they are not given for free by the government in government facilities. Most important factors to consider before a child gets vaccinated. Doctor's recommendation, we're seeing the figures there. Extremely important, 72.53. Effectiveness of the vaccine, 66.67. Personal experience with disease, which is very low, 41.87. Public health recommendation, 68%, 0.80%. That's percent, not 5, please. Recommended by trusted friend or family. You can see that they don't consider it important. Requirement by school or daycare. We are seeing that in Lagos is not emphasized by schools in Lagos. But as I was collecting data, I met a parent that came to Lagos with the sister to the hospital and said, in Abuja, if you don't come with your child immunization card, your child won't be registered in school. Risk level of diseases, we are seeing the figure, 53.33%. And we're seeing other safety of vaccine, seriousness of disease, side effects of disease, and side effects of vaccine. We're seeing the figures there. Vaccination uptake for I think for the youngest child. We're seeing that the mean age is 2.21, and also the modal age is from 1 to 6 years old, while the standard deviation is 0.94. The reasons parents gave for not following the recommended Nigerian immunization schedule for the oldest child were Akosoffe Health Center in Oroshoki. Some secondary, I've said it, some secondary vaccines were not available because they have to pay for it. Rotavirus, cholera, flu, HPV, hepatitis A, chickenpox vaccine. Some babies were newborn also, like 2 months old, and there are some vaccines they can't be given, while some were like 6 months, 9 months, 10 months, and 11 months. Some said because of their child study, they can't pull their child from school to take them to health facilities for vaccination. Some parents are also ignorant, misinformed, and were not aware of some vaccines like cholera, flu, HPV. Some complained of cost, financial constraint, lack of funds, time to take permission from work. Some could not find their child's vaccination card. A mother said that immunization is not very important. Then lack of knowledge of rotavirus benefits. Attitude of health workers discourage mothers from going to hospitals to vaccinate their children. Same as fear of contracting COVID-19. Because of COVID-19, people are not going to health facilities. Now, for mean and modal age for the youngest child, we have 1.5. Then the modal age was between 0 to 12 months, while the standard deviation was 0.969. The total number of the youngest children among our respondents were 280. Parents said yes, that their youngest child has received vaccination for the following. We're seeing the 5-in-1, 98.33%. And we're seeing hepatitis B, 98%. No, 5-in-1 is 99.64. Hepatitis B, 98.93. MMR, 77.87. And pneumococcal, very high, 98.33%, which is a very good one. Then while parents said no, that their youngest child not receive the following vaccine: chickenpox vaccine, 71%, 71.43%, influenza, 76.79%, HPV, 96%, very high. Cholera, 77.14%, rotavirus is 2.86%. The reasons they gave were also similar to the previous one. So, like, it was just similar. It's similar. Then, majority of parents have heard about COVID-19 vaccines, while 12.27% of parents guidance have not heard of COVID-19 vaccine. 53.07 said they won't vaccinate their children if COVID-19 vaccine is available. That's for children. Because I asked them, while 46.93% of mothers agree that they will give their children COVID-19 vaccine if available. If yes or no to vaccinate your child with COVID-19 vaccine, give reasons. Yes, reasons feedback I got where they said safety first. If it is given for free, I will ensure my child takes it. If it is a preventive vaccine, then it's a welcome initiative. And for no reasons, the feedback I got was because I feel it does not pass through clinical trials. Then some said they are yet to see the effectiveness of the vaccine. Some said it's not important. Discussion. The proportion of parents living in Kosovo and Shimodo local government area that are currently using vaccination is very high. And vaccination hesitancy for primary vaccine is very low. This is because the media had also had influence on parents' knowledge, attitude towards epidemics and vaccination. plus healthy practices. We are accepting the null hypothesis that high costs give rise to nonlinear responses in vaccine uptake, and thereby, and there may be other significant determinants like level of education, religion, media, choice, and decision of head of family, which determine epidemics and vaccination dilemma. Costs, if not addressed, can undermine several components of vaccination delivery, including vaccine acceptance. Improving vaccination costs is therefore crucial to achieving better vaccination outcomes, as well as greater goal of knowledgeable caregivers and communities. Important contributions to improving child health in many settings. Affordable costs could improve uptake of childhood vaccination, address incomplete vaccination, further strengthen routine immunization programs, and encourage the use of new and underused vaccines. Odis 2019. Conclusion. Income and cost of vaccine affects vaccination uptake because of the present economic situation in Nigeria. Because most mothers were not employed, those that were employed were not even earning up to 100,000 naira. Just few were earning up to 150,000 naira, and some were self-employed. Media plays a key role in vaccination campaigns, awareness, and intervention, and should be promoted more to achieve the goal of ensuring all children are vaccinated properly. Doctors and public health nurses have a major role to play in terms of influencing parents and guidance. Vaccination uptake. Recommendation. 1. Information on epidemics and vaccination must be made available to parents, guidance through mass media. 2. Government should make some vaccines like rotavirus, cholera, HPV, chickenpox vaccine free. Various stakeholders like community leaders, church leaders, health workers like doctors, public health nurses needs to promote vaccination uptake by leading by example in their various communities. 4. Schools, daycares in Lagos State must ensure that requirement for immunization card is mandatory before admission is finalized. Health insurance companies should cover for secondary vaccines so as to enable children enrolled under their insurance package to be properly vaccinated. These are my references. Limitation of study. This study was not focused on vaccine cold chain storage or supply and logistics of vaccines. The study didn't research on malaria vaccine knowledge and uptake. Suggestion for further research. This research didn't focus on malaria vaccination. Therefore, I suggest that research should be conducted to forecast the proposed malaria vaccination dilemma. Thank you.
Dr. Adaora Isabella Odis, thanks for your presentation. It's a wonderful presentation today as a first member. So I received some of the questions in the chat box. So can you able to answer all those things? So first question asked by John, what was the ethical approval number?
Ethical approval number. The number.
What was the ethical approval number?
Oh, if you can give me some time, I'll go and check the documents and check for the number. I don't have it by heart.
Okay. Next question. So, what is the alternative hypothesis asked by Gabden?
The alternative
hypothesis.
The alternate hypothesis.
Yeah.
Because we're talking about high costs and other factors like education, cultural differences, religion, being we have it here. This was my null hypothesis. High costs give rise to nonlinear responses in vaccine uptake, and therefore there may be other significant determinants like level of education. Now, the alternative should now be like that high cost does not give nonlinear responses in vaccine uptake, and meaning that may not be other determinants like level of education, religion, media, choice, and decision of head of family. That's
I have another question, Dr. Adaora. Kindly clarify on payment for vaccination for children.
The payments. In the past, health insurance company do pay for some vaccination, for childhood vaccination, but these days, they barely just cover for primary vaccines. So while I was collecting data, I had an experience. Many parents were stranded. They thought maybe their insurance company covers for secondary vaccines like rotavirus and so on, and cholera, which they don't do. And vaccines are quite expensive. So most parents now pay out of pocket if they are not going to government health facilities like the Bagada General Hospital and the Kosovo Health Center. So they pay out of pocket to access vaccine for their children. Thank you.
We have a next question from John again. How did a lay person understand what autism and other medical jargons were? Was the questionnaire translated into local languages?
Yes, I had to employ a Yoruba intern who helped me to explain to them in Yoruba, because in some places, like the health center, most of them were not educated. So she helped me to communicate with them, translate, ask them questions in Yoruba, and then they gave us their feedbacks, and the questionnaires were filled, because they can't read and write in English, but when you speak Yoruba, then they understand. Then I also met some people that were Igbos, but they can't read and write. So I did the translation myself. If I find out that you are Igbo, then I communicate with you in Igbo and get my questionnaire filled. Thank you.
Thank you. We have another question. Hepatitis A, chickenpox, and the likes are not in the general immunization schedule. Cholera vaccine is usually given through SIAs, places where the disease burden is high. This is asked by Simisola. We can review the NPHCDA guidelines on immunization.
Okay. And the national primary the guidelines on immunization is for the government. That's why we are giving recommendation. This is what the government needs to put into consideration. I said government should make some vaccines like rotavirus, cholera, HPV, and chickenpox free, because if they're made free, then it can be accessed by mothers that want to give their children. That's why my recommendation is saying number 2, government should make it free. I think I've answered that question.
I have another question. Can you clarify the point about attitudes of healthcare workers that may deter parents to bring children to vaccination?
Thank you for that question. I noticed that when you ask mothers to come to health center, you see them fidgeting, they're afraid because of the attitude of the healthcare workers, especially the nurses. Very rude, talk to the mothers anyhow. I have also had an encounter when I took my child to a government hospital to meet a pediatrician. It wasn't a very good one. That's why I don't like going to the government health facilities. I prefer to go to our family physician who has his own private clinic, because you're not meeting a rude nurse or a doctor. Everybody is very professional, carrying out his or her duties. Thank you.
And we have another question. Is malaria vaccination now available in Nigeria? Asked by Ms. Grace.
Thank you for that question. For now, it's not available in Nigeria, but it can be found in Ghana and I think Burkina Faso. But for now, to the best of my knowledge, it hasn't come to Nigeria.
Well, thank you, Dr. Adaora Isabel. You have some more questions in the question box. Lagos has 20 local governments and 57 LCDAs. How did you arrive at 37 local governments, and what technique did you use to select your local governments?
Okay. I'll go to my methodology. I said I use a multi-stage sampling. That's the first sampling method to classify the local government. And then I started using simple random sampling to select 2 local governments from the 37 local governments. I'm not familiar with the Lagos. This is sampling. Yes. So you can see that there are different sampling methods I use, the multi-stage sampling, and then the simple random sampling to pick 2 local governments from the 37 local governments areas. And then after picking the 2 local governments, I had to list the health. I stratified the list of hospitals according to government hospitals, health centers. There are many health centers in Kosovo, then private hospitals. So in each one, I picked 1, 1, 1, leading me to have chosen Bagada General Hospital, making it the government hospital that that was selected. Then the Orosheki Health Center, which is in Kosovo local government. And then for the private hospital, I picked Arjolad Hospital, which is the private hospital. That's how simply the sampling method I use.
Thank you. I'm having 2 more questions, Dr. Isabel. Is chickenpox part of routine immunization schedule in Nigeria? If yes, what is the frequency? Asked by Mr. Ibrahim Musa.
Chickenpox is not part of because it wasn't given in at the health facilities that were the government, the health center and Bagada General Hospital. So I don't know. I don't think it's part of the. It's not part of the government routine vaccines given to children. So the only frequency I have is those that are able to access it in private hospitals. Hello.
I have another question. Please clarify if hepatitis B is given at 3 frequency or only once, then the other does at 6 weeks, 10 weeks, and 14 weeks are in penta.
Yes, it's given. It's given at I think 6 weeks, 10 weeks, 14 weeks. I have it in my presentation here. Hepatitis B recommended at 2 months, 4 months, 6 months. That's it.
Okay. Thank you so much for answering all the questions raised by the presenters here. And I would like to thank you one more time for the wonderful presentation done by you. Thank you, Ms. Adaora Isabella Odis. Thanks for your time. Have a great day.
Thank you so much.